Welcome to Meyer Medical and Chiropractic Clinic, where we developed a video program to inform you of the treatment you will receive and the services we offer. Chiropractic doctors care for patients of all ages, with a variety of health conditions. Chiropractors are especially well known for their expertise in caring for patients with back pain, neck pain, and headaches, particularly with their highly skilled manipulations or adjustments. They also care for patients with a wide range of injuries and disorders of the musculoskeletal system, involving muscles, ligaments, and joints. These painful conditions often involve or impact the nervous system, which can cause referred pain and dysfunction distant to the region of injury. The benefits of chiropractic care extend to general health issues, since our body structure affects our overall function. Chiropractors also counsel patients on diet, nutrition, exercise, healthy habits, and occupational and lifestyle modification. After arriving, you will be asked to fill out forms that will provide Dr. Meyer with your medical history and reason for your visit. After completing these forms, you will be brought into one of our examination rooms. Next, we will perform a thorough chiropractic examination, including blood pressure, pulse, respiration, and reflexes, as well as more specific tests to assess your problem areas. These tests include range of motion, muscle strength, neurological integrity, orthopedic, and neurological tests. Based on the results of the history exam and chiropractic exam, diagnostic studies may be needed. The two most common diagnostic studies are X-rays and MRIs. The doctor will review the results from your history exam, chiropractic exam, and diagnostic studies to develop a specific diagnosis for your condition. Once the doctor has your diagnosis and determines that chiropractic treatment will benefit you, the doctor will discuss with you your diagnosed condition and individualized chiropractic treatment plan. You will then be ready for your first adjustment. Before continuing, Dr. Meyer would like to go over a few terms with you. The first and most important is subluxation. The definition is atypical anatomical positioning of any joint or incomplete or partial dislocation. When your vertebrae misalign, it creates subluxations. With subluxations of the spine, many times the results are pain, swelling, and limited range of motion. Subluxations are also the most common cause for pinched nerves. What most people are not told is that these pinched nerves can affect their organs, tissues, and cells in the body. If you have a pinched nerve and you feel pain, then whatever the nerve connects to in your body cannot function properly. Also, you may have heard of the term sciatica. Sciatica is the most common nerve pinched from subluxations. Sciatica results when subluxations put pressure on the nerves that form the sacral plexus, causing pain radiating down the legs. You can also have subluxations that affect the brachial plexus that exits the cervical spine and controls the arms. Next, we'll look at the term adjustment. The definition being manual and mechanical interventions most often applied to the spine, where controlled, direct force is applied to a joint to correct subluxations and to restore normal nerve flow. The last term is technique, which refers to the type of manual or mechanical adjustment used to correct subluxations and misalignments. Your first adjustment. After Dr. Meyer has discussed with you your specific diagnosis and chiropractic treatment plan, you are ready for your first chiropractic adjustment. We've briefly mentioned the different types of adjustment techniques, but keep in mind that no matter the technique, the ultimate goal is to relieve the subluxation or fixation. During a typical chiropractic adjustment, Dr. Meyer places you in specific positions to treat affected areas. Often, you're positioned lying face down on a specially designed padded chiropractic table. The doctor will use their hands to apply a controlled, sudden force to a joint, pushing it beyond its normal range of motion. You may hear a popping or cracking sound as the doctor works your joints during the treatment session. The doctor may choose to use the activator method, drop table method, or any number of non-forceful techniques. At some point during your treatment plan, your doctor will evaluate your progress and adjust your plan accordingly. After your first adjustment, you're likely to feel the effects immediately. Patients sometimes describe the effect as a surge of energy and a feeling of well-being. Many patients report an almost instant decrease in symptoms that they've been experiencing. It may be the first time in years that the normal energy has been able to reach some of the areas of the body without interference. It is important to remind you that the doctor didn't treat or cure your headaches or backaches. They located and corrected the subluxations that made it challenging for the body to take care of itself. Patients who receive immediate relief also have to be reminded that severe subluxations may have created extensive damage. Several adjustments may be needed before the vertebra can be restored to correct alignment. The temporary disappearance of symptoms doesn't mean the optimum health has been achieved. Following your first adjustment, make sure you stay hydrated, Avoid strenuous activity 30 minutes directly after adjustment, and follow any other recommendations the doctor has given. Our practice uses many therapy options that complement your chiropractic adjustment. We choose from these options aiming to find the best therapy to suit your treatment plan. For example, relaxing muscle spasms, increasing blood flow to muscles, preventing atrophy, and increasing range of motion, the doctor might choose electric muscle stimulation. Ultrasound is used when aiming to decrease your healing time by increasing blood flow to treated areas. Ultrasound would also be used to reduce pain caused by swelling and to soften scar tissue. Mechanical traction is a therapy option used to stretch and mobilize the spine, stretching tight muscles and reducing pain. Mechanical traction may also be utilized to widen the intervertebral foramen or spaces in the spinal cord to relieve nerve root impairment. The doctor may suggest a few therapeutic exercises to assist in range of motion if you are experiencing weak joints or when joint pain is limiting your mobility. Massage therapy may also be recommended to reduce muscular pain and tension, relieve back and neck pain, or to increase general flexibility. Your doctor may use all or none of these therapies depending on your history and chiropractic exam. Why do chiropractors adjust extremities like the jaw, ribs, shoulders, elbow, and hands? Chiropractors have always looked to the spine for fixations and subluxations. These fixations and subluxations can also occur in the extremities, which can sometimes cause spinal problems. The term extremity generally refers to the joints of the body besides the joints of the spine. More often than not, the spine will be checked and adjusted before an extremity is checked and adjusted. The goal of extremity adjusting will be to analyze and evaluate the extremity and establish a treatment plan that complements the spinal treatment plan. If you are experiencing any of the extremity symptoms listed on the screen, bring them to your doctor's attention. Whiplash is a generic term applied to injuries of the neck caused when the neck is suddenly or violently jolted in one direction and then another, creating whip-like movement. Whiplash is most commonly seen in people involved in motor vehicle accidents, but can also occur from falls, sports injuries, work injuries, and other incidents. Whiplash injuries most often result in sprain strain of the neck. A sprain occurs when ligaments that help support, protect, and restrict excessive movement of the vertebra are torn. When muscles and tendons are stretched beyond their normal limits, you have what is called a strain. The discs between the vertebrae, which are essentially ligaments, can be torn, potentially causing a disc herniation. The most common symptoms of whiplash are pain and stiffness in the neck, sometimes extending down into the shoulders and arms. Headaches, especially at the base of the skull, is also a common symptom seen in more than 2/3 of the patients. These are just a few examples of whiplash symptoms. If you've been in an accident, it is important that you mention it to your doctor. Another important aspect of whiplash is that the signs and symptoms often do not develop until 2 to 48 hours after the injury. Ice and heat are often used to help control pain and reduce the muscle spasms that result from injuries. Other physical therapy methods such as electric muscle stimulation or ultrasound may provide some short-term relief, though they should not replace the spinal adjustments provided by the doctor. Did you know that about 31 million Americans are affected by lower back pain? Or that 50% of all Americans who are working suffer from back pain each year? This has made it one of the most common reasons for them to leave work. According to experts, about 80% of the total population would experience back pain at some point in their life. The back is a complicated structure of bones, joints, ligaments, and muscles. It is obvious that sports injuries and auto accidents can cause lower back pain, but sometimes it's just the simplest of movements. For example, bending over to tie your shoes can have painful results. In addition, poor posture, obesity, arthritis, and psychological stress can cause or complicate lower back pain. Chiropractic spinal adjustments are safe and effective lower back treatment. It reduces pain, decreases medication, and rapidly advances physical therapy and requires few passive forms of treatment. After an extensive study of all currently available care for lower back problems, the Agency of Healthcare, Policy, and Research, a federal government research organization, recommended that lower back pain sufferers choose conservative care first, and it recommended spinal adjustments as the only safe, effective, and drugless form of initial professional treatment for acute lower back problems in adults.